Hi, I'm Rahel Sopat, and I'm here at MMRTI with Salam Mescano. So today we're just going to be talking about the Seattle-King County Clinic. So what is your role at the Seattle-King County Clinic?
So in the past, I was an intern about 5 years ago when it was the first year that they put it together. I was in graduate school studying public health, so I interned with them doing community outreach and like organizing the community outreach and communication aspect of it. So when it came up this year, then I'm volunteering with them to also continue to do that work.
Okay. So what are some of the services that you guys offer?
Yeah, so the Seattle-King County Clinic is a very large free clinic for both dental, medical, and vision. And so all sort of things within that. And it's happening Thursday, September 20th, and it goes until Sunday, September 23rd. And it will be at the KeyArena at Seattle Center. So like I said, everything is free. Dental includes, for example, fillings, extractions, x-rays, and deep cleanings. For eye care, they screen vision. They also do a complete eye exam, and then they also are able to provide reading glasses and prescription. For medical, they have physical exams, they have lab tests, mammograms, x-rays, so they have a lot of different things. For people who are interested in learning more, they do have a website and they have a phone number, so we can put that for them to be able to learn more.
That's a lot of stuff with them.
Yeah.
Like, that's great. But, are there any requirements for you to be eligible for this clinic?
That's a great question. There's actually no requirements, so anybody is able to come to this clinic. It's completely free, but in addition to that, there's no need to register beforehand, so you actually just show up the day of the event. So any of the days, you just show up in the morning, you line up, they give you a ticket, and then they just call the numbers one by one until everybody's seen in the clinic. And I think the one thing I want to give as a tip based on my experience with this clinic is that, of course, it's happening Thursday through Sunday, but as you know, Saturday and Sunday, most people don't work, so there's going to be more people who are going to show up at the clinic. So if people can, it's best to go to the clinic on Thursday or Friday. So there'll be less people that you have to, stand in line with. And then another thing that's really important that I want to say is you don't necessarily have to live in Seattle or King County to come to this clinic. It doesn't matter where you live. They don't ask for ID. They don't ask for your immigration status. They don't ask whether or not you have health insurance or not. This is really meant for anybody who wants to come and get free services. It's probably one of the most unique kind of clinics. I think anywhere you go, they at least ask if you have insurance, do you have ID, what's your immigration status. So this is completely open, it's completely free, and no requirements for people to be able to use it.
Okay, so I would assume, since this is a mainly how the shell network, how about if some of the people that are going to the clinic don't speak any English?
Yeah, that's also a really great question. So they do have interpreters. They definitely have Tigrinya, Amharic interpreters. They might have more East African ones. I just can't remember right now. Again, there's a website for people who want to go and make sure that the language are represented. But yeah, we have interpreters. And one thing I wanted to say in terms of waiting, because it is going to be a long day, I encourage people to bring a snack or water with them because you might be waiting for a while to get services, so it's helpful if you have those things pre-prepared.
Yeah, makes sense. So you named a lot of services they do provide, but what are some that they might not provide?
That's a good question. Good question. I mean, I think probably a lot more complicated dental eye, kind of, they're not going to do any sort of surgery that day because it's literally the KeyArena. So if you've ever been there, it's like a big open space. It's like it used to be a basketball arena. So they definitely won't do anything super complicated where you need to be go under any medicine to be able to perform. So any sort of surgery or anything like that, they wouldn't be able to do.
Okay, it's more another thing is this seems like a really big event. It's going to be at KeyArena. So, once you get into the clinic, kind of what is the go down? What do you guys how does everything work?
Yeah, so when you first arrive, there are free parkings for people who are coming to the clinic. There are two parkings. Ooh, I can't remember where this is, sorry. There's two parkings. Oh, sorry. So yes, one parking is at Mercer Street Garage, which is 650 3rd Avenue North. And then there's another parking, First Avenue Garage, which is 220 First Avenue North. So as you first come in, you go ahead and park there for free. And then you come into the KeyArena. There's going to be a big tent that's set up for people to be able to come in and have a seat. And then they will, about 5 a.m., they'll go ahead and hand out all the tickets to people. So once they hand out all the tickets, then it's a matter of just sort of waiting, and then someone will come, call your number and help you go to the registration. They'll say, okay, what are you needing today? Do you need any interpreter? Do you need anything else? So they kind of, will assess what you need, because you could go to, they've kind of divided out the clinic. So there's like medical is in one wing, and then there's dental is in another wing, and vision in another. So they kind of will find out a little bit about you, what you need that day, and they'll triage you, and they'll be able to send you to where you need. And so hopefully you'll be able to see a doctor, you'll be able to see a nurse, or whatever you need, get the services you need, and then be out of there as well. Yeah.
So this is something that must take a lot of time and effort. So how did this program come about, and who are the people putting their time into this?
Yeah, so there's a lot of partners and stakeholders involved in this project. The biggest one is Seattle Center. So Seattle Center is actually a branch of the city of Seattle, which was something new that I didn't know as an intern, is when I learned that they are part of the city. And so they've noticed that there is this big need for people who kind of fall under the crack, that either whether they don't have insurance, or sometimes clinics are not always accessible to them for whatever reason. So there's a lot of people in our county, King County and Seattle, who are not really able to receive the services that they need. So the Seattle Center made a commitment to be able to provide this service every year. And so there's the team within the Seattle Center that does this, but of course there are many partners and many companies who donate money to be able to have this clinic. So I don't have a full list of those groups, but it's on the website if people want to look at them. In addition to organizations who are investing money, there are also lots of volunteers. So medical associations, dental associations in Washington are talking to their dentists and medical providers, and they're letting them know that they're needed to be able to provide the service. So none of the clinic providers are paid for this. Everything is free. So they sign up, one day or all the way to 4 days of service to be able to do that, from 5 in the morning to all the way to 10 p.m. So it's a very long day. I know, for example, the University of Washington Public Health School is involved because they're doing evaluation. They're asking patients, how was your experience in the end of the clinic, so that the next year the experience could be better. So there are many people. I would, call out to anyone who's sort of watching this, if you're interested either in this year or next year in being able to be a translator, or even just helping patients navigate, because there's such a big space and lots of things happening. If there are people who want to, volunteer, again, go to the website, and there's a volunteer site on there, so you'll be able to see kind of all of the things that are needed, and you can provide services that way.
It's really great to hear that a lot of people like you and others are just putting all their time and effort into just helping others with nothing in return, you know what I'm saying, but just kind of knowing they're helping people that's really amazing. Thank you so much.
Yeah, absolutely.
So just a reminder, it is on September 20th to the 23rd. It is a 4-day event at the Seattle Center, specifically KeyArena. Hopefully everyone can make it because it's a really great event. It's free. It doesn't matter if you have health insurance or anything. I mean, I think everyone should go. Even our staff here at MMRTI has went. It's just good to make sure that everything's okay. And like I said, it's free and there's no questions asked.
I hope that people will come because it's a great opportunity. Like I said, I mean, where can you find a place where you're just able to walk in and get all these free services? I hope that people will come because it's a great opportunity. Like I said, I mean, where can you find a place where you're just able to walk in and get all these free services with interpreters, with all these services? So I hope people take advantage of it.
Hi, Rahel Ibalalo, and today I am with Salam, and today we're going to be talking about the Seattle King County Clinic, which is a clinic for free at Seattle Center for September 20th to the 23rd. We're just going to be talking about the benefits, what you can get at the clinic, parking, like all the stuff to know about it, and she's going to be also summarizing everything in a part.
እንግዲህ በአማርኛ ለመናገር ትንሽ የፕሮግራሙ እንግዲህ የሲያትል ኪንግ ካውንቲ ክሊኒክ ነው የሚባለው። የነፃ የአይን የጥርስና ጅስ የሰውነት ክሊኒክ ነው እንግዲህ ማለት እና ከሐሙስ ሰፕተምበር 20 እስከ እሁድ ሰፕተምበር 23 ድረስ ነው ፕሮግራሙ። KeyArena የሚባለው እንደ ስቴዲየም ቦታ ማለት ነው ሲያትል ሴንተር። እና ሌላ ኢንፎርሜሽን ከፈለጋችሁ ሞር ዲቴል ነገር ከፈለጋችሁ seattlecenter.org/patients የሚባለው ዌብሳይት ሄዳችሁ ሌላ ነገር መማር ትችላላችሁ። ስልክ የሚመቻችሁ ከሆነ ደግሞ 206-884-7200 ደውላችሁ ሌላም ነገር ጥያቄ መጠየቅ ትችላላችሁ። ትልቁ ነገር ማለት የሚፈልገው ሁሉም ነገር የሚሰጠው እዚህ ፕሮግራም ሁሉ ነፃ ነው። ስለዚህ የአይኑን የደንቱን ሁሉም ነገር ነፃ ነው። ስለዚህ እንደገና ደግሞ አስተርጓሚዎች አሉ። በነፃ መኪና ማቆሚያ አለ። እንደገና ደግሞ ያልኩትን በእንግሊዝኛ ትንሽ ቆይቼ ምንድነው ሐሙስና አርብ ቢመጣ ይሻላል እላለሁ። because ቅዳሜና እሁድ በጣም ብዙ ሰው ስራ ስለማይኖረው ይበዛል። ህዝብ ስለሚበዛ የዛ ጊዜ ሐሙስና አርብ ብትመጡ እንደውም ለእናንተ የሚሻላችሁ ይመስለኛል። እንግዲህ በጣም ቆንጆ ፕሮግራም ነው። ሁሉም ነገር ነፃ ነው። የሕክምና ዋስትና አያስፈልግም። የኢሚግሬሽን ጥያቄ አይጠይቁም። ምንም ነገር አይጠይቁም። ጀስት ገብታችሁ የፈለጋችሁትን ሰርቪስ የምታገኙበት ቦታ ስለሆነ እንድትመጡ በጣም እጠይቃለሁ። አመሰግናለሁ።
Like I said, thank you to you and everyone else who's volunteering, so I hope to see you guys there. Bye.